Do you care about being on social media? How's the hip doing? So the sacrum sits in between your iliums, which are your hip bones. The sacrum goes out of place. It can cause pain through the hips, low back. It's also the bone that your spine stacks on, so it's like an upside down triangle. All the vertebrae in your spine stack on it like Jenga. So sometimes that sacrum can rock backwards from sitting too long, especially in a poor posture. And so setting that back into a neutral position where it wants to be help take away some tightness and pain in the low back and hips. So each adjustment is always a little different, especially as we unwind issues. You shouldn't be adjusted in the same place every time. There might be an area that's more common, but as we unwind different layers, then we're going to find different pieces of the puzzle to unwind and get things back to optimal. So we actually screen every bone in the hips and pelvis. I think this technique is probably the most thorough at finding hip and low back pain. So we check sacral tubercles, we check coccyx or tailbone, we check a rotated ilium here, we check a crooked or AI sacrum right here, we check the femur, we also check the front side of the hip, which is the pubic bone. All of his are doing just fine right now. And then we also go back eventually and we'll check spots in the low back that can cause torsion in the hips.